Medispa is committed for the 100% satisfaction rate of our clients.
Hi, my name's Dave. I'm from Liverpool, if you can't tell by the accent.
Hi, my name is Jared Carney and I come from Ireland.
Hi, my name is Mark. I'm from Australia in Melbourne.
My name is Nathan and I come from the United States. Medispa in Jaipur, and I've just got the transplant done last night.
Jaipur, India, to have a hair transplant with Dr. Sunit Soni.
I came to Jaipur for a hair transplant with Dr. Sunit.
I found the procedure to be very painless and he got maximum graft.
Yesterday I had a transplant of 4,600 grafts.
Experience has been amazing. Medispa Clinic.
Dr. Sunit came across the most professional and most experienced.
FUT is the best for maximum graft.
As far as having an operation is concerned, I was pleased with the lack of pain.
My experience was very good here, and Dr. Sunit
was very good, absolutely great results. So I'd recommend coming here in a heartbeat.
Pleased with the results. By the way, the hack comes free.
First step in hair transplant is local anesthesia. In local anesthesia means we will numb this scalp by a medicine which will affect only your scalp. You will be awake and conscious, and the skin part of the scalp will be only numb. Generally people utilize big syringes and needles, and that causes a lot of pain during local anesthesia injection. What we use is insulin syringes for local anesthesia. This is a very small thin needle, that's why the pain during the injection is less, very less. So what we do is first we numb your skin by ice packs so that it becomes numb, and then we use vibrator to reduce the pain of needles further less, and with the help of vibrator and insulin syringe the pain of local anesthesia can be reduced to less than 10% of the actual pain. So once this local anesthesia is given all around your scalp, it will be numb and it will be hard as a coconut. It will feel like a helmet or a tight band, and it will be numb. But did you experience pain during the local anesthesia? Was it comfortable? If somebody wants safe transplant, he should look for a specialized clinic or a center which is equipped with good operation facilities. This is our modular operation theatre in which we have all sort of facilities to take care of the patient, like pain, blood pressure monitoring, ECG monitoring, and we have all the machines for emergency use. Like we have defibrillators here. It's a defibrillator which can be helpful in cardiac arrest, and there is a ventilator here if there is a rare possibility of any respiratory arrest. So these are important equipments for life-saving conditions which are very rare, and in emergencies we do have all backup of these instrumentations.
We are doing FUE extraction. In FUE extraction we have newer device which is known as Transplant. Transplant system, it's an important system. What is the advantage? Initially it rotates for epidermis and partial initial dermis. A tough part it rotates. As soon as it goes to the softer dermis part, it just oscillates.
So
To and fro. Yeah. Okay, because the third root which is going outside, it will not rotate 360, it will just oscillate. And once it go to the fat layer where the actual bulb is, it just vibrates and applies some suction out for it.
So it pulls the third one out without
transaction, because it's not rotating, it's just vibrating and sucking it.
Okay.
It comes, the sucks the third root and it damages further reduce. These are our technical team of hair division, and we have almost the biggest team in India. Almost 15 technicians do the simultaneous job in one day for one patient. So that's why the dissection is faster and it can be completed in 3 to 4 hours. We can divide around 4,000 grafts in just 4 hours. And you can see this room is specially built for just dissection. It's equipped with German microscopes, around 15. We have video assisted microscopes that are one of the best in the world. That's why the precision is there. The team is trained from last 7 to 8 years. One person is assigned only one job, that is division. One person is dividing around thousands of grafts per day. So he is very precise and very much trained, specific for this purpose of division. You can see this room is sterilized every day, so it is always infection free for every type of patient. We do one patient in this room one day, and the sterilization process is done for these microscopes also. Plus you can see all people are properly have cap mask, and these are sterilized tables. They are properly draped with the autoclave instruments, and you can see the hair division. They are doing precise hair division, keeping it in chilled autoclave saline. So they are properly stored also. After division, they are storing it for normal saline, and they are keeping a count on every graft. They are keeping a bunch of around 50-50 hair, that is around 25 grafts, so that we can easily count how many grafts one technician has been dividing. So at the end of the procedure, every technician gives his total count, so it should match to the implantation count or the plant hairs which are grafts which we are trying to implant. So accordingly, I will make the slits or the holes in precise direction and pattern. Generally, PRP is taking blood from our body out, concentrating them into 5 times concentration, and then taking the platelets from that blood and then re-injecting in the scalp. As you can see, we harvest the blood. It should be in proper quantity, like 20 to 30 cc. And then we should centrifuge in a proper technique. For example, there is a soft spin. Then we harvest the upper and lower portion. From the upper portion, we again do a hard spin, and then from the hard spin, lowermost portion is taken as the PRP. Then the platelet counts are checked in the lowermost portion, and we expect it to be at least 5 times.
This high concentration gives excellent growth of hair transplant because it delivers lot of growth factors. It also enhances the healing, so it heals the things very faster. So we will inject in the implanted as well as the donor area, both the areas.
While injection, we have to be very sure that per square centimeter we will get at least 1 lakh platelets. So if there is 100 square centimeter area, we have to get almost 100 lakh unit of platelets. That means at least 10 cc of PRP. For that, we need at least 40 cc of normal blood. So the quantity of PRP injection is important, as well as the quality, that is concentration of platelets, is also important. So if proper quantity and quality is achieved, very sure we will get good growth, less failure rate with the PRP. What I am doing is slitting. Slitting is a punch making or hole making procedure. I may do it with needles. Why the needle is better in our sense? Because a needle is always fresh, it is sterile, because I use a needle for few holes and then change it. So I can frequently change to a new needle every time I am making few holes. So sterility is not a question. In contrast, if I use some sapphire blade or anything else, a instrument which has to be sterilized again and again, so the blunt, it will become blunt with time, less sharp, as well as the obviously sterility might be a question every time, isn't it?
Yeah.
So I don't think there is some extra advantage of any instrument apart from needles to use. So there are a lot of clinics who will promote that we use sapphire blades. Again, sapphire blade is a solid blade. I am using a hollow needle. Hollow needle will take some tissue out from your skin, so that when we are putting a new graft, a tissue in, there is a proper space for fitting. If I make this hole with a solid thing will only part the tissue, it will not take anything from inside. Okay?
So you make your hole, but to put the hair in,
Yeah.
you know, right? Factors. I don't know how it goes.
There are a few forceps. The forceps are designed to hold the hair and push the hair gently inside the hole. So it's a snugly fitting graft which goes inside, and with the fibrin glue it stuck and get pasted. So the final step of filling the hair is done with trained technicians who are very much experienced. They have been doing transplant and filling job with me since last 10 years and plus. They use microscopic magnification for seeing the things clearly. They use Choi implanters to fill the grafts so that the kinking is less, growth percentage is high. At Medispa, we ensure 95% plus growth percentage, combining with all steps of transplant.
The ultimate aim of my transplant to give a proper face to the patient, a younger look and a natural looking hairline as well as density and pattern. That was my promise. Plus you can see from the back side the scar is almost hidden in the hair and you can't see any scar of the strip method, which people generally are scared of because we are doing a trichophytic closure method. So scar is not an issue at my center because of the expertise of trichophytic closure and cosmetic surgery which I am doing.